Greetings to another episode of the Hawkins STEM Chronicles. This episode, Trauma, a production of the Hawkins Center for STEM. Dr. Jennifer Ryu explaining trauma from a clinical perspective.
One of the things that you deal with are people with trauma. So let's talk about that for a second.
Sure.
Define trauma.
Well, the first thing I want to say about trauma is that everybody has trauma. Trauma is not just for military veterans or sexual assault survivors, but in the world we live in, it's a traumatic place. And so we all have some form of trauma that has either occurred to us or is part of our environment. And the reason I say that is that I think it's very important to normalize the idea of trauma because there's a lot of stigma around trauma. And when we can kind of get to a place where we realize this is ubiquitous, we all have trauma, especially now with a climate crisis and a lot of environmental degradation and species loss and the pollution that we deal with, that's part of the trauma that we're just absorbing on a daily basis. So there are a lot of root causes of trauma. Some of them can be adverse childhood experiences. Some of them can be relational in origin. Some of them can be being a victim of a crime or living in a community that is being subjected to environmental injustice. There's a whole spectrum of possible causes of trauma, but basically it's pretty hard for anybody to escape in this day and age.
Now, and I'm going to let the audience in a little secret. It's one of the reasons why a lot of times when we do these videos, we try to have a lot of greenery around and a lot of fresh air and a lot of quiet. And if you can have the mourning doves and have some of the other bird species, that just adds to the nature of it. It's a very calming environment. Mm-hmm. But let's play a little game. I'm going to mention some things and you're going to tell me whether or not it's trauma or not trauma.
Oh, okay.
Living somewhere where there's traffic, major heavy traffic, 24 hours a day, and you have to listen to the noise of the traffic. Is that trauma? Can that be trauma?
It could be. I mean, it really depends on the person. Some people have more innate resilience, especially if you get to if you have very difficult and challenging experiences as a very young, either in the womb or as an infant or as a toddler, your resilience is somewhat depleted by that. Mm. So that could mean that you're more easily triggered into a trauma state. If you kind of advance into, the elder stages of childhood without trauma, perhaps you have more resilience and you're able to just kind of cope better. But also individual to individual, for reasons which are not always known to us, but some people they bounce back better. They have better physiological bounce back, or they have better psycho-emotional bounce back, or even spiritual bounce back, because trauma, according to certain medical paradigms, is a spiritual condition, because it really disrupts our innate core sense of self, and our nervous system sort of chronically becomes vulnerable when we have experienced trauma.
Suppose someone is in an environment where they or someone in their family is shot. Is that trauma?
Absolutely, absolutely. So any type of violence, whether that's physically on ourselves or somebody we care about, is very traumatic, because relationship is the foundation of really what it is to be a human being. Mm-hmm. And so that's a rupture to a relationship, and that can end up being very traumatic.
What about incessant family fights?
Yeah, I mean, I think part of my family is Italian, so they're kind of quite loud. And so some people who aren't used to that, I'll bring them into that environment. They'll say, whoa, what's going on? But that's their normal way of communicating. They're not actually fighting. So, but if there's actually, really verbal abuse in the environment, or a lot of hostility or anger, absolutely, that can very much be traumatic. It's just wear and tear on the nervous system over and over.
What about losing a job?
Yeah, absolutely. And especially in this society where we identify with our jobs very much, when people meet each other, almost their first question is, what do you do? Uh-huh. Which in other societies, it's not like that. And they say, well, who is your family? Or, where's your community? What landscape do you live in? But we are very, capitalistically oriented and professional role oriented in this society. So some people are incredibly traumatized by losing a job, and not to mention the financial repercussions.
So I don't even get into finance. So now, how do you recognize trauma in a friend or a neighbor or a relative?
Yeah, I mean, I think that's something that has to be taught and learned. If it's something that's occurred in the, now or recent past, you're basically looking for differences in what their normal behavior would be and their current behavior. So somebody might not be able to sleep. They might normally have been very dependable, and all of a sudden they're showing up late to things. They have a kind of brain fog or an inability to kind of make decisions or practice optimal discernment because the trauma affects cognitive ability, right? It gets in there, and we sort of are not ourselves, meaning we appear sort of differently and behave sort of differently, but also our ability to engage with the world is compromised in what we would consider normal ways. Oh, I'm showing up to my job on time. I'm, studying and getting good grades. So say you're in an educational environment and you have a student who's always done, quite well, and all of a sudden the homework isn't getting done. They come to class looking exhausted. It's important to inquire about these things and not just kind of make excuses in the moment. Well, I'm sure they'll be fine. It's better to really start asking questions. I noticed you're really tired. I noticed, a couple assignments have been late. Is there anything bothering you? Is there any stress that you're experiencing? And that's an open invitation for the person to start letting you know what's happening.
Now, how do we recognize trauma in ourselves?
Another good question. I mean, some of the same things apply. I'm not sleeping. I'm not eating properly. Maybe I'm very irritable or tense. Maybe my relationships are affected. I'm not able to communicate well in those relationships. Maybe I'm off my regular routine. Maybe I give up exercising because I'm too overwhelmed. So there are a lot of ways that we can see in ourselves that we're now not in our best place of coping. We're not taking care of ourselves, and we're not taking care of our relationships.
So if you notice trauma in your own life, how would you recommend people treat that? How would you, as a professional, what kind of treatment would you recommend?
So, I mean, it very much depends on the person. It's very individualized. I think we have to recognize what is the source of trauma. Different types of trauma would be approached differently. Do we have environmental trauma? Is this person experiencing eco-anxiety or eco-grief related to the Earth poly crisis? For that, there are certain group support processes where a person can simply express their emotions about feeling a sense of loss about how nature used to be for them. But if it's a personal trauma, say I'm a victim of a crime, or I was let go from my job, we've got to start looking at where are the strengths and resources. Can we pull in the person's family to support them? Counseling is obviously always a good option, so a person can talk about not just what happened to them, but what are their feelings around that, process that. We can just do nervous system regulation. So it could be mindfulness, it could be breathing, it could be yoga, it could be supplements or herbs which help to pacify the nervous system, because that's a kind of very material way to intervene that doesn't require a lot of effort on the person's part, but it will assist them. And then it's very hard to ask someone to make behavior change when their nervous system is a 5-alarm fire. So sometimes if you go in and pacify their nervous system, then you can start asking them, well, you know what, we need to regulate your sleep schedule, we need to make sure we get you to the gym, we've got to start dealing with some other stress coping mechanisms. There's a lot of angles that you can begin from, and it depends on the person.
So now, another question, and you kind of touched on this when you talked about supplements and supplementation. Can diet help with trauma? Absolutely.
When we are eating, let's take ultra-processed foods as an example. Basically, there's very little nutrition there. And the body, because it is largely preservatives and chemicals, the body really doesn't recognize it and is not able to metabolize it and use it as fuel. So a person eating ultra-processed food may constantly feel depleted, even though their caloric intake may be, adequate. Also, if you're not eating enough fruits and vegetables, that is a lot of minerals, a lot of vitamins, and a lot of fiber, which is part of what helps. And it's also a lot of fluids, Those things are often very hydrophilic. So all of that helps the body to regulate itself and to eliminate properly. And all those things are part of having like a balanced physiology. So nutrition is very important. Excess caffeine is a recipe for anxiety, so we have to look into that. Excess sugar is very hard on the nervous system, so we have to look into that. Some foods are very inflammatory. That's an extra load on your physiology. So if we can reduce that, the body can attend to more central matters like nervous system regulation. So yeah, nutrition is important in a lot of ways.
Now, and this may be kind of a tough question, but is the best way to approach this that one can treat trauma or one can heal from trauma?
Well, I think both. Yeah,
okay.
I wouldn't say one or the other. Treating trauma may be something that's more confined in the moment or happens over time, but healing from trauma is really a diachronic process, right? It really happens over a long period of time. Diachronic just means extended over a long period of time. And so, and that's something that I think people have to recognize. Healing from trauma is not something that is instantaneous or even short-term. It's multi-layered. It's like peeling an onion. Well, this year, I really worked through this layer of trauma. And then maybe 5 years later, you'll realize there's another layer. I need to attend to that now. So, yeah.
And I think that word work is, I don't know whether or not that gets missed a lot, but dealing with trauma can almost be like a job because you've got to work with things.
Well, it requires personal commitment, I think, and one has to be there for oneself. So it really brings up the issue of relationship to self. Often we think about our relationship to others more than we think about our relationship to self. But relationship to self, we have to be our own best friend. We have to be self-compassionate. We have to be self-forgiving, and we have to be non-self-judgmental. Those are all really important things in terms of approaching trauma, because that little critical voice in your head can just, exhaust your resources, and make it that much more difficult to heal from trauma. So it's very important to attend to relationships with self.
Now, before we close up, is there anything else you want to say about trauma?
I think we've covered a lot of the bases. I think that it's really important for each of us to just know that everyone has trauma and to be on the lookout for how that might express itself, to be on the lookout for our own nervous system burden and when, our nervous system cup is overflowing, and to kind of get in there and attend to that as quickly as possible. Because if left, sort of unaddressed, the consequences can be much more severe on our relationship with other people, can create a lot of ruptures in our social fabric, and also with the self. It's important that we have a social support system, but also within ourselves we have a system of support.
Because it kind of sounds like what you're saying, in addition, that trauma can also contribute to disease.
Oh, for sure.
You know, if you're stressed out, you're worried, you're scared, you're still dealing with emotional pain from whatever, going back, like either the death of a wife or death of a husband or death of a parent, death of a child, you've got to figure out a way to deal with that trauma.
Yes, I'll give you another big word, psychoneuroimmunology.
Okay.
So how our mind is in terms of our psycho-emotional health affects our nervous system, and our nervous system is very much tied into our immune system and the gut-brain microbiome axis. Everything is connected, and Western biomedicine has for many years functioned from an organ system perspective and seeing things as separate, but is finally, thankfully now, kind of coming around to, actually all these things affect one another. Mm-hmm. So the state of our mind and our psycho-emotional health absolutely affects our physiology, and really in the moment, it doesn't even take that long before that happens, because the nervous system, when on high alert, will draw energy away from the immune system or the metabolic system or other systems in the body that are constantly functioning, just trying to create a baseline state of health. So we've got to be aware that trauma is a drain on physiological health as well. Well,
thank you very much. And I got to get you out of the sun before you melt. It's got to be almost 100 degrees out here. Anyway, thank you all very much. If this is the kind of content that you want to see, that is educational, that is learning-based, that is fact and truth-based, please like and subscribe. Thank you so very much.
Thanks for joining us. Trauma is a serious and often misunderstood topic. The purpose of this video is to help define trauma in clinical healthcare terms, beyond what's often portrayed in television and movies. If you're experiencing mental health challenges or believe you may be suffering from trauma, please seek support from a trained, licensed medical professional. If this kind of content is valuable to you, don't forget to like, subscribe, and hit the bell icon to stay updated with the latest from the Hawkins STEM Chronicles.